My name is Peter Crosskey, and I'm the UK web correspondent for ARC, the Agricultural and Rural Convention. On the other end of an internet connection, I have Dr. Aysha Akhtar, author of the book Animals and Public Health, Why Treating Animals Better is Critical to Human Welfare. This monograph was published in the UK this week by Palgrave Macmillan. Dr. Akhtar is speaking in a personal capacity today, and the views she expresses are solely her own. Dr. Akhtar, thank you for finding time to...
Thank you for having me.
You're very welcome. In the opening to your book, you wrote that until animals are treated better, human beings will never find health. Please can you tell us how and when you arrived at the link between animal welfare and human health?
Well, I actually first started to notice a link between animal welfare and human health when I was doing rounds in the hospitals. I'm a neurologist by training, and I had noticed that I was seeing more and more patients come in with stroke at a younger and younger age. And people were getting strokes, and still are, in their 30s. And one of the common themes I found when I would interview these patients is that so many of them eat really poor diets, and diets very heavy in animal products. And of course, that's not the only factor, but diets heavy in animal products is one of the main contributing factors to stroke and cardiovascular diseases and many other chronic diseases like diabetes. And in the U.S., at least, and I think I could probably say this throughout the world, meat has become a lot cheaper. And so more and more people are eating meat and other animal products, dairy and egg products. And a lot of this has to do with the fact that there's been an incredible change in the way animals are raised for food now. And so animals are now raised in industrial farms, or the more layperson term is factory farming. And that type of farming has led to very cheap meat. Cheap meat leads to more meat-centric diets, and that's led to higher incidence of chronic diseases like stroke. So when I first started seeing that in the hospital, that got me thinking. And of course, most recently, we've seen the connection with bird flu that emerged in 2005, or avian influenza, and swine flu, or what's now often referred to as H1N1, which emerged in 2009. And those two influenzas are directly and indirectly related to changes in animal agriculture.
Thank you. And has anyone else actually made a connection of this sort between animal welfare and public health in the past?
Oh, sure. What I'm saying here is really not new. There have been many people who've thought that there's a connection. I mean, even going back to Socrates and Albert Einstein and Albert Schweitzer have suggested that if we harm animals and if we ignore their welfare, it's going to come back to harm us in one way or another. And of course, their statements were a little more vague, and there was no direct evidence necessarily to support those statements. But today we have very direct evidence, and that clearly shows that there is a direct and sometimes indirect link between how we treat animals and our health. The Johns Hopkins School of Public Health, the Pew Commission, and the United Nations Food and Agriculture Organization all have reports that they've published looking at the connection between industrial animal agriculture and human health. So there are a lot of disparate, voices out there that are starting to, or have been over the past few decades, to recognize this connection between human health and animal treatment. The difference is that this book that I've written is I believe the first book to actually put it all together and bring it all into one coherent theme that basically sums it up by saying that if we harm animals, we're harming ourselves.
Thank you, Dr. Akhtar. So if industrial society could rebuild its relationships with other species and develop a greater insight of how the natural world functions, that presumably would be a step in the right direction.
Absolutely. I mean, today, and the changes that we've had in industrial farming, this is one of the most profound changes we've had in our relationship with animals in human history. And so we now view animals not as living sentient beings, but as production units. And today, over 64 billion animals are killed and farmed annually for food. So that means that at any given time, over 9 animals are on this planet for farming for every 1 human being. And that heavy reliance on animal farming and the enormous number of animals that we are farming and killing for food is having a price. And it doesn't just go to farming. I mean, we are using animals in more ways and in greater numbers than ever before in ways that cause them harm, whether it's through factory farming, whether it's through destruction of their natural habitats or the wildlife trade or in the laboratories. We are harming more animals than ever before. And one of the things that allows for so much of all this harm to continue to go on, I believe, is the fact that it's mostly hidden away from the general public. So most of us don't really know what's happening to animals. Most of us don't really know what the life of a pig is like in a factory farm. We mostly don't know what the life of a rat in a laboratory is like. And I think that naivety and ignorance is going to be problematic. And we're sort of living in a kind of evolutionary vacuum where we're not really connected with the animals in this world, the animals that we are using in one capacity or another. And that's going to come back to harm us. And I don't think we're going to be able to get around the fact that our lives are intricately linked with those of other species. What we do to them impacts them, which in turn comes back to impact us. For centuries, for example, the evolution of the influenza A virus has remained quite stable, but in recent years it's undergone a real evolutionary surge. For example, since 1990, outbreaks of different influenza virus subtypes have increased substantially among farmed birds compared to the years prior to 1990. Mm-hmm. And one of the main reasons, or the main reason for this increase in these outbreaks of these viruses is the factory farming that's occurring, the industrial changes in animal agriculture. The dense confinement of animals is one of the most significant factors that's leading to this surge in the evolution of the influenza virus. It's also a significant factor in increasing the risk of a number of infectious diseases, such as E. coli, Salmonella, Yersinia, Brucella, and even foodborne illnesses. You think about it, an industrial farm of 5,000 pigs produces as much waste as a city of 50,000 people. Mm-hmm. And that waste is not just super high in nutrients that cause pollution of our waterways and our land, but it's also contaminated with infectious viral and bacterial particles. So that's another way in which we get infected from animals that are farmed in factory farms.
Mm. Thank you, Dr. Akhtar, for sharing your personal insights into a problem that challenges our preconceived notions of what we need to do. Dr. Akhtar, thank you.